Welcome to today's webinar titled Putting It All Together, Fall Prevention in Your Community. My name is Erin Lacerte. I am on staff at the Colorado Department of Public Health and Environment. I will also be moderating today's webinar and providing you with support when needed. Today's webinar is the final webinar of the Building Community-Based Falls Prevention Programs webinar series. This webinar series was developed by the Colorado Older Adult Falls Prevention Coalition, specifically the Community-Based Older Adult Falls Prevention Team. Members of the team represent hospitals, public health, and other organizations. The team's mission is to reduce the risk of falls through education, raising awareness, advocacy, and improving access to resources. The role of the team is to provide leadership and guidance for local falls prevention efforts. Today's presenters are Lindsay Myers, Program Manager at Colorado Department of Public Health and Environment, and Sally Thorson, the Injury Prevention Coordinator at Colorado Department of Public Health and Environment. Without further ado, I will turn it over to Lindsay.
Hi everyone, thanks for joining us for our 7th webinar in this series. We appreciate you participating and also are really encouraged, if you haven't been able to participate in previous webinars, that you check them out on our website. Erin just shared that information and it'll be shown again at the end of the webinar where they are all archived and you can view them there. And I'm just trying to, there it goes, I think. There we go. So what I'm going to do today is try to wrap up and give you, for those of you who were not able to join us for the full webinar series, just a brief overview of the topics that we've covered in the last 6 webinars. And then we're also going to start diving into, what do you do with all of this information? How do you take this and really apply it, particularly in a community-based setting, though a lot of the strategies and the examples that I will be providing will be examples from how we at the Colorado Department of Public Health and Environment have used these same strategies to start to develop our programs that we're implementing for older adult falls prevention. We will review briefly just a recap of the evidence-based practices for fall prevention, discuss building community partnerships and why it's so important to have a whole crew with you when you're trying to develop programs and partnerships. I think for this issue, because it's so multifaceted, are really even more important than normal to having a good program up and running. We're also going to talk about whether an evidence-based program is a good fit for the capacity of your organization or for your community, and elements of fidelity that are important to successful program implementation. And then, as I mentioned, I'll give you a few examples from our work here at the Colorado Department of Public Health and Environment of how we've kind of implemented these programs. And for those of you who are from Colorado, which I think the majority of you are, give you an idea of if these programs that we're starting to build infrastructure for through the Colorado Department of Public Health are something that you do think will be a good fit for your community. We'll give you some tools to determine or to decide how you can go about doing that and how to access training and those types of things. So we structured, the Coalition, Older Adult Falls Coalition, decided to structure this webinar series around the 5 building blocks of effective community-based fall prevention programs. This model, or this terminology, comes from the Centers for Disease Control and Prevention, but I think it's a really nice comprehensive way to look at older adult falls prevention. So just real briefly, we had webinars on each of these 5 topics, as well as one webinar that was specific to data and providing an overview of older adult falls issues, particularly for Colorado. The first content webinar that you viewed was about education. And we talked about, the need to really send the message to older adults, to their caregivers, as well as to providers in the community, medical providers and other types of providers, how important it is to look at falls as a preventable issue. Falls can be prevented, and they can lead to greater independence and increased quality of life. During this webinar, you heard a little bit about 2 programs that really have education at their core, the Stepping On program and the Matter of Balance program, both which have very strong evidence base and are really set at getting older adults to talk about and to do their own problem solving so that they can know kind of about all aspects of those programs. So I'll speak a little bit about the Stepping On program later in the presentation, but it was I think a great webinar, and again you're encouraged to check it out if you happen to miss that one. We also talked about exercise as the second building block. It was a third webinar in our series. And we talked about, sort of the best practice involved with this type of intervention, that it must be the type of fall prevention exercising that's really important is it must be present at moderate to high challenge levels for balance in particularly, and it must be done for at least 2 hours per week and should be done for over 50 hours. So it really needs to be something that's ongoing. During this webinar you heard about a number of exercise programs or programs that have some content related to exercise, such as Stepping On and Matter of Balance Do, and then ones that target exercise more specifically like Tai Chi and In Balance, both of which have a lot of evidence base behind them. The next webinar in the series was medication review and management, and we learned that falls risks increase when older adults are on 4 or more meds and are using certain class of meds. And so it's really important to talk about different strategies, working with pharmacies, working with hospital systems and insurance providers to really to worry or to do these medical medication reviews with older adults, particularly those that are on multiple types of medications, to make sure that they are not contradicting each other and causing some issues there. Next we had a webinar on vision, vision and exam, and the best practices found that there's a nice increase in fall prevention with home safety intervention for those with low vision, and this reinforces the idea that fall prevention is effective in populations at the highest risk. I think of all the building blocks, this one is pretty intuitive. I think that to have good vision really does impact your balance and helps prevent falls, and so this was a good webinar talking about the different interventions that work particularly for folks that have low vision. And then the last webinar in our series was around home assessment and modification. You heard from a couple of folks here locally in Colorado that were pilot testing a community to identify safety concerns in older adult homes by emergency medical service providers. We also heard someone around from a fire department talk about their home safety audit programs, and an occupational therapist that gave an excellent presentation on home modification as well. So I think if we will keep these presentations archived on our system, so anytime you're thinking of exploring one of these areas again, I encourage you to go back and visit them. So now to put it all together, how can we coordinate these programs at the local level? For the content of this presentation, I'm referring heavily to a document that the CDC put out in 2008 called Preventing Falls, How to Develop Community-Based Fall Prevention Programs for Older Adults. This is available on the CDC website, and you can either order a hard copy for free through their website, or you can download a PDF copy. It is, I think, a really great tool. I'm going to highlight a few things from it in this presentation today, but it's actually a really helpful resource, particularly targeted at community-based local communities, community-based organizations and partners that want to do fall prevention. And so I highly encourage you to check out the full document, but we'll give you a few highlights here. The first step that you need to do, I think if you've been participating in these webinars, obviously you have an interest in this area and are trying to determine what kind of program would fit best in your community. And so the first step that the CDC recommends in this manual is to assess what the community's needs are related to this issue. So some questions to ask. What are the needs, prevention program needs in your community? what related programs or services are currently being offered by other organizations. So if you're perhaps at a local hospital or maybe an area agency on aging, really tapping into what currently is being offered by other organizations besides your own is really important to do to try to make sure that whatever program you're implementing is really meeting the need of the program or of your community. You also want to look at what organizations your organization's current and future goals and resources for providing services to older adults in your community. There are a lot of different players in fall prevention, and I think a lot of times communities struggle with which program to adopt, how to how to figure out which one is the right for you. And a lot of it, I think, has to do with really tying it to capacity and what is available in your community already to make those types of decisions, and we'll talk about that throughout the program. You also want to know how much support you have to start this program within your organization, within the community in general, because you definitely need support in order to be able to pull any of these programs off. And then what resources can you really, already exist that you can tap into and use, and what potential partners are there in your community. I can't stress enough the need to really focus on building community collaborations and really trying to figure out who you can partner with around these areas. And I'll give you a list of ideas of different types of partners to consider in your communities if you are thinking of creating some sort of coalition or group. But I thought it might be helpful to talk about different types of groups, because I think we often refer to, at least at the State Health Department, as coalitions or groups of people that are working independently in some ways toward their own goals, but also share goals with other agencies and are working together. And sometimes the nomenclature for all of these different groups can be a little tricky. These definitions come from a book that's also a really great resource called Coalitions and Partnerships in Community Health by Badr Foss, and I thought just briefly we could go through some of these. So a coalition is fairly formal. It's a formal alliance of organizations that are working together towards a common goal. We also have, my computer's not keeping up with me, sorry. We also have an alliance, which may be a little less formal, of organizations or organizations seeking to coordinate tasks, link funding, and seek resources. You may also hear groups referred to as a task force, which is a self-contained group of doers. That's not necessarily an ongoing group, but developed for a specific purpose. So it could be that, for example, if you were looking at fall prevention maybe within a hospital or within a particular organization that serves older adults, having a task force to really, build a program and get things up and running may be appropriate and not something that needs to be sustained long term. You may also have an advisory committee, a group that is formed at the request of your organization to provide, review, advise ideas and recommendations, and gives input for decision making, but they don't, the ultimate decision doesn't rely with them. So again, if you were going to do something, for example, run a stepping on program through your hospital system, you may want an advisory committee of community members, of other people to help advise how that program is going to go, but you may actually need the ultimate decisions about that program to rest within your hospital system. So an advisory committee would be appropriate there. You could also have an executive board or a committee, and this is a group that is sort of delegated to govern maybe a larger body of groups, or also, maybe something that's with a specific task or a specific focus. And then you might also just have a network of people within your community that you're kind of loosely tying organizations together. You may communicate, but it may not be through formal meetings or through like a formal structure. Many of you I know have heard of the Fall Prevention Network, and that's sort of the exact idea behind that. That network exists in the Denver metro area, and was led through work that the Tri-County Health Department at the local level did in partnerships with many, many stakeholders over 5 years' time to really build a network of partners that that are really tied together for all areas of the building blocks of fall prevention, which is great. So, ultimately in your communities, a network like that may be something good to look towards. So some partners to consider. You definitely want to consider public health departments, healthcare organizations, hospitals, senior centers, parks and rec, emergency departments, faith-based different programs, areas on aging, and a lot of different types of providers, occupational therapists, physical therapists, vision specialists, etc. So the list goes on and on and on. This is discussed in more detail in that book that CDC put together, but I think the idea that really thinking through each of the building blocks and depending on what type of intervention you might be looking to bring to your community, or especially if you're thinking of building a whole network of agencies in your community that address fall prevention, really tapping into these various partners is important to do. So the second thing, after you've kind of done all that needs assessment, you know what the partners are, you know kind of what's going on or what's not going on in your community, and you've pulled together some sort of group to help you form this, whether it be an advisory council, a coalition, an alliance, what have you. It is really important to develop some sort of purpose statement or goal statement for your program. These types of programs can really get big really fast, and so being as specific as possible is a really good idea. Some of the questions that CDC recommends you ask are, why are we developing this program? And I think sometimes in our efforts to really do great work, sometimes we forget to step back and actually ask that question. What do we hope to accomplish in both the short and long term? How can we, do we really need to do this? Is this what we need to focus on? Some of your problem statement may also include some things like this. These are just a couple of slides that came from the first webinar in this series regarding data, but really looking at, okay, what's the problem? What are we trying to do? Are we trying to impact, costs? Are we trying to reduce hospitalizations for falls? Are we trying to reduce deaths due to falls? Is it all of these things? For us at the State Health Department, when we were looking at our leading causes of morbidity and mortality, this is one of the areas that we definitely honed in on because of all three of these reasons that are listed on this slide. The next thing that you'll want to do for your community is take a look at your data. And so this is just some state level data that we pulled. And again, this is discussed in more detail in that first webinar, but you can see that over time, falls death rates are increasing in Colorado, and so it definitely rose to one of our top priorities just looking at the data. And so for us, being a statewide agency, it was really important to look at interventions that can, ultimately have some long-term outcomes. We also looked at fatal and non-fatal injuries and deaths and hospitalizations. So again, taking a look at your data to see, who are you really targeting. From this chart here, you can see, really 75 and up is where the bulk of the hospitalizations, deaths are much higher in 85 plus, and a little flip-flop where men have a higher fatality rate from falls, but women have a higher hospitalization rate. So trying to figure out, depending on what you're trying to impact, what group you should be targeting. It's also important to try to, if you're doing this in a local community, obviously to get this data at a local level. So through the Colorado Department of Public Health website, we do have data available at the county level for older adult falls. This is a screenshot from our Winnable Battles data that we're really trying to look at falls related hospitalizations among older adults at a statewide level, and so this is just a way for local communities to see at a glance what their how they compare to other communities, how they compare to the state as a whole, so that you can be part of that. There's also other data sources available through the website, death data, hospitalization data, and we do as a state just now as of this year, have access to emergency department data at a state level. We are delving into it and starting to see what that tells you. It's not up online yet, but that is something that you can request for your county and that we can run for you if that information would be helpful to you for planning your interventions. So after you look at the data and what you're kind of looking at, it's also good to know what programs are already out there. What does the evidence base say? Because all of us have limited resources, and targeting these programs as best we can to foster team is very, very beneficial. So I'm going to turn this over to Sally Thorson now, and she will walk you through some of the evidence-based practice.
Okay, thanks. This is Sally. Let me get started. So my section for this webinar is to just sort of review the evidence-based practices for fall prevention. And in doing that, first question, of course, is what does evidence-based mean? It means that are programs that are known to work, and the way they're known to work is not just because they feel good, but because there's been research, there's been evaluation of the program with measured outcomes, meaning the outcomes are not just to how many people participated, but it's the outcomes of either a reduction in falls, a reduction in risk factors, a reduction in fear of falling. And the programs have been replicated, so it's not just one study. And there are usually key elements that are identified, and I think this is really important when you look at evidence-based studies, that you figure out for yourself, if it's not given in the article you read, what are the key elements that were important, so that when you duplicate things, you want to duplicate those key elements, not just take bits and pieces of the program. So why use evidence-based programs? Funders are really starting to require it, that you need to prove that what you're picking is either a packaged program or it's one that's based on these elements. And agencies themselves want proven results, so how much better it is to say, as a health department or a hospital system, we know that we want to reduce falls, so we want to use these programs that are proven, and therefore that's worth our time and effort, and our agency should see those results. And people who implement programs like package programs, if you're going to do something like stepping on, matter of balance, or Tai Chi, you don't have to decide how you're going to do the program, how often you offer it, how do you advertise it, that kind of thing. It's already packaged, and if you follow that program, you won't have to do quite as much evaluation because you already know that it works. And older adults really like programs that work, and I think this is an important one that often we forget, but we want to get older adults to take these programs, and by being able to say, this program's been done in a lot of places and it really works. Hang in with us for this time period and you'll see similar results. Can really help them believe that their time is valuable in the time they spend with you. The evidence-based fall prevention, there's really kind of two ways to look at the evidence. One is, what are the guidelines of how you should do things, and then what are the exact programs that work. So for guidelines, 2010, these are important guidelines, American Geriatric Society, as well as the British Geriatric Society and American Academy of Orthopedic Surgeons. And the things that they came up with that were effective were screening and assessment of older adults, managing clinically those older adults, balance, strength, and gait exercise programs, and modifying the home environment. So these, of course, are geared towards healthcare providers who are working directly one-on-one with older adults. So that really kind of started everyone's thinking towards, let's make sure these things are happening. And some further recommendations from the U.S. Preventive Services Task Force, and this recommendations from this group are ones that a lot of family physicians look to as their guidelines. So these are, again, important recommendations. And they just came out in May of this year. One is that vitamin D supplements can help prevent falls in older adults, and this is an important recommendation. It was kind of back and forth whether vitamin D supplementation was effective, and further studies indicate that it is. And the other recommendation that they really put forward is that exercise and physical therapy to improve strength and balance of older adults has been shown to prevent falls. So that's an important criteria too. Now family physicians are really getting that word that these programs are effective, and I think it behooves all of us to make sure these programs are then available. The other recommendation, which is not a little more controversial or not as pleasing for some of us in the fall prevention world, is that the recommendations did not recommend that physicians automatically do in-depth risk assessment with their patients and comprehensive management of identified risk, because in the studies doing this provided little, if any, success. So it does leave it open to individual doctors can decide who needs this type of assessment and work. Trying to, let me see, move those slides forward. I'm not having any. Erin, are you able to move this? This is like I'm stuck.
Yeah, I don't think I can do anything from here.
I don't know why I'm there. Let me make sure I didn't miss one there. Okay, the other important group that we look at is the Cochrane Collaboration Review. And again, this was fairly new, coming out this year, an update of an earlier review. And again, strength and balance exercise programs come out as a best practice. Home safety interventions for high-risk folks, not necessarily effective for just everyone in the community. And then multifactorial assessment and treatment for individuals that need it. And also sort of in the medical area, our vitamin D for people who are deficient, and often in climates, northern type climates, and in places like Colorado where people aren't outdoors all the time, it may often be that people are deficient. Withdrawal of some of the medications in cataract surgery and our pacemaker, those have shown to be effective. So I wanted to just first review the best practices for the multifaceted. That's sometimes what we think of. It seems overwhelming that we have to do everything for older adults. And individualized risk assessment and targeted interventions to those risk factors may be warranted. And that's something that healthcare providers who are seeing patients have to decide how much to do and then how to get all of those risk factors addressed. And some, but not all, of the multifactorial programs are effective. That means taking on that big program where every person you contact, you're going to do exercise programs, medication review, vision, and all of those things. And that can be overwhelming, and if you decide to do that, it would be important that you make sure you're following best practice for each of those individual units within that program. But it's also true that single intervention programs can be effective. Exercise programs are known to be effective even if they're not combined with all of these other aspects. And also if you're dealing with high-risk populations, and I'll talk about a few of those. So if you're going to do a single thing like home safety, try and orient that towards the high-risk folks. So some of the studies have started to be completed on economic evaluations to find out what really works for the amount of time and effort we're putting into it. And exercise programs generally come out as being effective those particular ones that we've talked about before. Home safety assessments and modification for high-risk populations, and again, withdrawal of some medications, cataract surgery on the first eye. Oddly enough, if you need cataract surgery on the second eye, you don't see an incremental increase in fall prevention. And then really extensive multifactorial programs that were done primarily in Europe have been cost effective, but our American system of healthcare and healthcare billing and so on may mean that doesn't necessarily mean they'd be cost effective in the U.S. So now I just want to go through those 5 building blocks just to go over what we talked about as best practice for each individual area. One is that education. Well, education, we all know, is really important. There's no evidence that education alone is effective. So providing information to older adults and telling them what they need to do doesn't lead to decreases in falls. And we all know that you need more than that. But the messages and the venues are really important. So that message, convincing people that things can be done, that falls can be prevented, and the venues, how you're reaching older adults and where you're reaching them and who you're talking to are important. And adult learning techniques are known to be more effective, and some of those Lindsay mentioned, they're ones that stepping on and matter of balance use. We also heard some things during the seminars about patient perceptions and preferences. So when people believe that something can really be done, they're more likely to enroll in programs and get the benefits from those. And also figuring out what are the patients or population really able to do and how can they participate instead of just listening to us tell them what they should do. So exercise really comes out as a single intervention that's effective. So in some regards, if you want to do fall prevention in a community setting, get together the right partners that can provide exercise programs for your older adult population and figure out the marketing tools and advertising to get the older adults into programs. Yeah, Lindsay mentioned this, but the programs really involve muscle strengthening and balance retraining. So simply increasing walking or going to whatever programs might be at the gym or just exercising while sitting in a chair is not necessarily going to lead to fall prevention. It needs to be that muscle strengthening and balance challenge. And the programs, again, should be challenging to balance so your body is relearning how to handle balance challenges. And it's twice a week for a period of time, so you're getting as close as possible to 50 hours of work and then keeping up some of that work. For medication, the high-risk people are those with 4 or more medications, and we heard some information on different programs where pharmacists are working on with healthcare providers on types of alerts or letting them know what are medications they might choose to use instead of some, or converting older adults from psychotropic medications, that those kinds of things are effective. So a straight medication review doesn't really have evidence of being effective, but it can be part of empowering older adults to talk to their doctors and getting pharmacists and healthcare providers working together on solutions. And for vision, while vision and getting yearly vision exams can help prevent progression of eye diseases, that alone may not be enough to prevent falls. Home safety programs for visually impaired were really effective. Cataract surgery can prevent falls, and there's some evidence from a small study that people, when they're outdoors, maybe don't need those progressive lenses or bifocals, but they need a single lens so that they can really concentrate on what they need to see to prevent falls. And home safety assessment and modification can be effective. It can be very involved and take a lot of time and effort, so it's important to look at who are the high-risk people. most of the programs that really showed great success were ones given by an occupational therapist. And I think that doesn't mean you have to use OTs, but I think it does mean that we need to be thinking it's not just the OT expertise, but the OTs talk to the patients and figure out ways that the patients can move around better in their home. So it's not just a checklist and pulling up rugs, but it's involving the client and the family in the decision making. And during one of our webinars, it was really a client-centered program. So that's what we think about with home assessments. There are a number of programs, and we've talked about them in the webinar, and Lindsay mentioned those. And here are some locations in the seminar will be archived, but the CDC lists programs that have evidence-based, National Council on Aging, and Administration on Aging. Sometimes a program will be in one list but not the other because the level of evidence that's required may vary, and some programs can be added to the list as well. For public health, we look a lot to this document, Preventing Falls, What Works, and it talks about those rigorously tested, effective interventions. So that's my part on the best practices. Now I'm going to hand the presentation back to Lindsay.
Okay, so thanks, Sally, for that. And I just thought I'd kind of sum up what Sally said there by mentioning that we often think of evidence-based practices in some different ways, and there's sort of not only different levels of evidence, as Sally mentioned, but there's also different types of evidence-based programs, some of which have more guidance to them than others. And so some programs are what we call, at least internally, kind of packaged programs. Stepping On is a good example of this, or Matter Balance is another great example of this. Programs that have some pretty good infrastructure, that have manuals about their implementation. It gives you kind of a step-by-step what you need to do, and it's all there for you for resources. And then there's programs that I don't have a picture here, but like Tai Chi Moving for Better Balance, that I'll speak a little bit more about in a moment, which in this compendium you see here from CDC is one of the strongest programs in terms of the rigor at which it was evaluated and the impact that it has on older adults, one of the strongest ones you can get, but the downside is it doesn't have kind of a nice packaged manual like this in terms of implementation. So if you're a community or a state health department thinking of trying to implement these programs, it's important to think through, not only what it says in this evidence-based compendium, but how are you going to translate that to practice and to make it really usable and implement it in your community. And I think, sometimes what ends up in the research and what actually translates to practice sometimes is different. And so with any program, there's an element of sort of that translational piece that you have to do, and some are easier than others to implement. The other side here, I just want to mention guidelines. There's obviously guidelines from various different organizations. The big one from here is the kind of the Gerontological Society of America's recommendations for fall prevention, and Sally mentioned several others in her program. And so what's tricky about these are great evidence-based guidelines, but then you have to put those in a program and decide what you're going to do with them and how you're going to implement that in your community. And there's really pros and cons to both of these types of things. I'm just trying to advance the slide. So while it's thinking about it, I'll just mention some here. So there's some pros and cons. Some of the pros, obviously, of package programs include that they've got all the instructions there for you, that often they have all of the information that you're going to need. They're shelf ready, and they may not, as Sally mentioned, need extensive evaluation because they have already been evaluated, and you can just implement them. And what you're really looking at is making sure that you implement it with fidelity, or implementing it as close to those implementation instructions as you possibly can. And often these programs like Matter of Balance and Stepping On have some infrastructure even at the national level to have technical assistance and things like that. The cons for this is that just because it's packaged doesn't mean that it has good evidence. So the ones we've been using here as examples and throughout this webinar series, do have some evidence that they work, but just because they kind of come in a pretty box doesn't mean that that level of evidence is the same for all of the programs. So it's definitely something to consider. Where are you getting that program? Is it something that's specifically mentioned by name in the compendium of evidence-based programs, or is it something that is maybe thematically similar but not the exact program, and then it might be worth looking into what that evidence shows. The other downside to package programs is sometimes they're expensive because they've been evaluated, because they have infrastructure, some of them at the national level, or a train-the-trainer structure that is complicated. There's fees associated with being licensed to do those programs, and so that's something to consider when choosing what program works well for your community or for your organization if you're the lead on implementing it. There also sometimes is limited flexibility. The great thing is about these evidence-based programs is that they've got a lot of evidence, but the bad thing is for a community fit is that there's sometimes not the ability to really tailor it and expect that you're going to see the same results as they did in the randomized control trials or however it was evaluated. And it can also, you always have to take an eye at looking at what other programs exist in the community, and is this program going to contradict or compete with another program in the area that you may not want to set that up. There's also pros and cons associated with guideline-based programs. On the one hand, they are adaptable to local situations. Because they don't have a package and a strict methodology in terms of how the implementation needs to happen, that gives communities a good fit. And often these guidelines provide some guidance on what key elements you definitely need to have. Often guidelines are based on evaluated programs, and sometimes there's technical support, but most of the times they're not evaluated at a high level, like a randomized controlled trial, which is what RCT stands for there. And the key elements may not always be clear. It may not be clear how to implement that in your setting. So I'm going to speak at the end here in a few minutes about the STEADY program, which is a great example of an evidence-based guideline program, and it's just new, and we're trying to figure out how we need to do the implementation, which means it needs a lot more rigorous evaluation, and that sometimes can be resource intensive. So these are all things about what you need to consider when deciding which programs are best for you. It's also important to consider the readiness of your community. Are these things, is talking about fall prevention brand new in your community or within your organization, or is there some sort of readiness to work on it, and what you're really deciding is just the what are we going to implement and how. Goal alignment I mentioned earlier, making sure it fits with your goals, and then your capacity. Your capacity being realistic, can we really implement this in the best way that it needs to be done? You need to consider your target audience and your ability to carry through and sustain it, and as well as trying to think about, okay, what kind of approach is best for your position in the agency. Is it important that you are kind of a one-on-one type of agency that can implement something, or maybe something more in a group setting? So thinking through all of those things are important. In the Preventing Falls, How to Develop Community-Based Fall Prevention Programs guide that I showed earlier, there's some really good sections that I just wanted to highlight through. I know this is a little hard to see on your screen perhaps, but I encourage you to take a look at it in the actual chapter, because it goes through for each step of the building, each type of building block, and gives you some suggestions about who could deliver this program. So for some people, you can see yourselves on there. You know, your type of organization. If you're a pharmacist, for example, it would make sense that you would be in a position to do medication review, and so that might be a good fit for your agency. But I think, you know, as it should have been clear throughout this series, you know, this is a complex issue, and just one approach, you know, one type of medication review program at a pharmacy is not going to have the impact that likely you want, though it's an important piece of it. So looking at your other members of your coalition or partnership group to see, you know, maybe you don't implement that component, but is someone in your community doing these things, so that you can have a real comprehensive approach. But this book just gives you some ideas about different types of stakeholders that can best implement different types of building block programs. In there, you will also see sort of a location, you know, where do you conduct it is, you know, the real practical piece that you have to think through. You know, is this going to happen in a hospital setting? Is this going to happen at a rec center, a community-based setting? Or, as you can see, that first column that's listed there is in the home, and how many of these are actually, you know, done in the home potentially. So thinking through not only who is going to implement it, but where is the implementation going to occur really assists with program planning. There's just some other types of things. I've mentioned some of these things before, but I think this slide is nice. It comes from some evaluators actually out of Texas A&M University, and they're helping evaluate the fall prevention program that we've been doing, and allowed me to borrow this slide from them because I think it asks some really good questions. And so, you know, when you're thinking at the community level, step by step, what do you have to ask yourself to see? I think these are all really good questions to ask. You're looking at the program match for your organization. You're looking at costs and resources needed to implement that program. What types of facilitators are needed? What equipment do you need? All of those questions that, you know, when you're figuring costs, sometimes you forget about the little things like, you know, this program takes ankle weights for older adults, and those cost, you know, $8 an ankle weight, and do we really have the money to do that? And then also I think it's important to think about the cultural and contextual relevance of the program. You know, are the materials, if you're distributing materials, appropriate for older adults? Are they written in the right type? Are they written at the right literacy level? You know, is this the best way to get the information out to these particular groups? So we went through a very similar process to that questions when we were developing our grant proposal for the funding that we have now from CDC to implement 4 evidence-based strategies and kind of build the infrastructure for Colorado. As some of you know, and I mentioned this, I guess, briefly earlier, Colorado does have adopted CDC's model for winnable battles and has a winnable battle specific to injury prevention. And one of the metrics that we're measuring over the course of the next 5 years is decreases in fall-related hospitalization among older adults. And so that winnable battle, that priority in our strategic plan at the state level really was, gave us some buy-in at our department level, as well as a reason to convene stakeholders across the board. And when we were able to seek funding from the CDC around this, we had partners in place ready to help us think through it and work on it. So we worked with the Colorado Older Adult Falls Coalition, certainly, and we also worked with the Tri-County Health Department, which had done a lot of the fall prevention work in the state for the previous 5 years, and the Fall Prevention Network, as well as the State Unit on Aging, particularly the focus on matter of balance. We've been trying to look through how our work in bringing Stepping On is working with Matter of Balance, which has a great infrastructure in Colorado, and we certainly didn't want to bring in a new program and have it be perceived as competition. So, we've been trying to work with various partners to get this thing going. But this is our Falls project in a nutshell. And I show this to you not to go into a lot of detail about it, but rather to just show you that you know, these are the programs we're trying to implement through the State Health Department and through Tri-County Health Department for our grant purposes. But it's really a good example of you know, us going through the whole process I just described about trying to figure out what programs are a good fit where. So certainly having funding available and being the recipient of a grant helped us prioritize which programs we were going to choose since they were named in the grant for us. The other thing to know is we had to think about location, as I mentioned. You know, where can these programs be done? How are we going to get this out? And we were narrowed in focus in terms of for our funding where we could focus the programs. They wanted us to focus in a specific area, so we chose Adams and Arapahoe counties because of the work that Tri-County had already done there the last 5 years. So we were really trying to build on their infrastructure so that we could you know, be as successful as possible. But our intent is then to learn what we can through this funding and trying to build the implementation for all of these programs, and then we really want to expand it out and have it grow throughout the state. And I think it's some of that growth is starting to happen even before our project is over, which is great, and I think it'll continue to do that. Another thing to just you know, think about when you translate evidence-based practices or programs to practice, you have to think about, you know, how you're taking a program that was really implemented in a controlled setting and make it suitable for the community. And then how can you do the fidelity pieces? How can you adhere and make it as close to that controlled laboratory-like setting without having it be unreasonable for your community. And so we've been going through, you know, each one of these 4 programs and asking ourselves and our various stakeholders on the coalition and outside of there, you know, how to do that, because it's something that is tricky. So some of the things we're trying to look at core elements. You know, what are, for example, the core elements of Tai Chi Moving for Better Balance that absolutely has to be done, otherwise it doesn't meet the program. So looking at how often the classes are held, the length of the time the classes are held, the training that the facilitators have to go through, etc. So those are really important characteristics to make sure that that happens. And then the other thing that's very important when you're building a program is to really think of sustainability from the very beginning. And so we've been trying to do exactly that with the 4 programs that we're implementing here, and trying to think, you know, how can we set this up so that we can spread it across the state as soon as possible. So these are just some elements, again, from Texas A&M University, and I think it's nice to kind of think about it in this way, that you really do have to have effective leadership, you have to have a good delivery infrastructure, you have to have your partners in place, you have to have all of the logistics worked out, it has to be financially stable, and we also have to make sure that there's some quality assurance or adherence to fidelity. And so for each of these programs that we've been implementing, they're in different places. You know, Tai Chi, as I mentioned, doesn't come with a user manual, so we're trying to develop that. Sally's been working on some fidelity plans and trying to figure out, okay, how can we really design you know, this for implementation for other people in the state so that it's easy for them. And we just are completely indebted to the members of the Colorado Older Adult Falls Prevention Coalition that really have you know, helped us with this work, and we're, you know, working over time to build the coalition, to grow membership, to include some other state level players that have an interest in the area, and to really, I think the role of this Fall Prevention Coalition is to set up the infrastructure for the state so that local communities that might be creating coalitions at the local level can implement programs and have some good guidance to look to, even when the guidelines for the programs or the implementation is not quite clear. So we have just about 5 minutes left, so I'm going to go through this pretty quickly, but I just wanted to give you some sense of the challenges in our approach to each of these programs in Colorado. For those of you who are in Colorado and may be interested in how you get involved, particularly if you're in Adams or Arapahoe County, but if you're outside of those areas, there is opportunities to get involved and to help us build these programs across the state. So I'm not going to spend a lot of time talking about what Stepping On is. Definitely see our third webinar on exercise to give, or on education, our second one, give you some good information about here. But it's a group class, 7 weeks in a row, and then 1 extra class after a little break to do a refresher, and has very good evidence for fall prevention. So what we've been trying to do is build infrastructure at first within hospital systems as one of our approaches. So trying to build master trainer structures within hospital systems so that the training can happen there naturally. This program has a lot of different components and a lot of different disciplines that need to contribute to it, and so it's important to have all of those people involved, and so having it in the hospital system made sense to us as one way to start. But then we also wanted to build a sustainable training infrastructure, so we've been working with the Consortium for Older Adult Wellness, who already had a training center or a training academy that they host a couple of times a year, and so COA got trained as master trainers in Stepping On, again, because that infrastructure is already built there for people to use. And then this program didn't exist in Colorado before, so we need master trainers to be able to bring people in. And then the master trainers then conducts the fidelity checks for the programs and make sure that everything is happening according to what it is. We are, just to get the program off the ground, trying to where money allows, supply weights and other program materials just to help with the pilot, but we're doing a cost analysis to see how much all of this is going to cost, so that then we can give that information to other areas in Colorado and across the nation that want to implement the program and need to know what the resources are. And we're also evaluating it from the very beginning so that we know exactly what is going to be done. And we're promoting Matter of Balance as well, because this is a program that we also really support and want to see grow in Colorado. And although these programs are somewhat similar, I think there's plenty of older adults who need these types of classes, and hopefully there's, I think, room and different programs are better fits for different types of communities and agencies. So Tai Chi Moving for Better Balance. Our approach there is we don't have a master trainer, we didn't in Colorado, and so we've been working with the master trainer from Oregon, and we've also been working with the YMCA. So the YMCA now has 2 master trainers, one in Colorado Springs and one in Denver, who can help us build our training infrastructure over time. Our approach is to pay for instructor training, so we're trying to support trainers at first, particularly in our area that we're trying to evaluate in Adams and Arapahoe County, but as resources allow for other people from other parts of the state, we're trying to make that as available as we can. And we're training people on evaluation and data collection from the very beginning, so that that's really built into the program and people get used to doing it. And then instructors are allowed to charge for classes. So this was a little bit of fidelity or sustainability piece for us. We are building relationships with senior centers, churches, rec centers, looking at those locations, where is a good place to house these programs. And we're using our previous experience, or Sally's, I should say, previous experience on different projects in really how to recruit and retain people in older adults fall prevention classes like Tai Chi. So we are hoping to also do a master trainee class and a fidelity plan, etc. I apologize, we're going to go just a couple minutes over, so hang on with me, or if you have to jump off, this will be on the archive. I apologize for going over. So Otago, which I'm not going to go into for the sake of time, but was also covered during the exercise webinar, is more of an individually based program, and our approach is to work with home health agencies and to really try to work on the reimbursement strategies. This is a nice program because it comes with the payment structure already built in, but we are trying to figure out, how does that transition between different parts of Medicare really work in our system. So we're pilot testing it. We're lucky that at the national level there's web-based Atago training that's very inexpensive. So this program is already available right now for physical therapists or occupational therapists that want to implement this. So please let us know if you have some people who are interested, and we can connect you with those trainings. So that one I think will spread across the state fairly quickly as soon as we figure out some of the medical or reimbursement pieces. And then again, incorporating the evaluation from the very beginning and partnering with different partners to make that happen. And then the last thing I'll mention here is STEADY. This is a toolkit, again, some guidelines that CDC basically took the guidelines from the Gerontological Society of America and then put them into a toolkit for providers, primarily primary care providers or internal medicine providers, that will give them some resources to assess different do assessments with older adults, and then most importantly connect them to to providers in the community that can offer community-based programs such as Matter of Balance or Tai Chi, In Balance, etc. The exciting thing that I wanted to share with you now, because it just became available last Wednesday, the STEADY toolkit is now available on the CDC's website. So you can get to the link is at the bottom of the slides at the end, or you can just Google STEADY and CDC and you will come to here. But it has materials that you can order. It has materials for download, videos about how to do different assessments, etc. And so this is something that throughout Colorado, throughout the nation, if you are interested in working with providers that work with older adults, medical providers, this is really designed to get the entire practice involved with doing fall prevention for older adults, and the resources are all here for you. We are pilot testing the implementation along with Oregon and New York, which are two other CDC grantees, and so we're hoping to find some good implementation tips that we can share with all of you as we go down the road. But this is hot off the presses, just brand new, available to you. So if you are interested, please check that out. We are trying to reach 66% of all providers in Adams and around Arapahoe counties, and so this is going to be a challenge for us and for the Tri-County Health Department that's partnering with us to make this happen. But we're really hoping to use the existing infrastructure to bring these evidence-based programs and to create a system, a network where, or to use the network that exists in this community to really get these programs off the ground. And so we're hoping over time to be able to share what we learn with all of you so that you can implement this at the local level in your own communities. And again, I just wanted to end with saying, it's really important to evaluate your programs, test things, make sure they work in your community, and that's what we're involved with now, trying to pull all these pieces together and hopefully come out with some implementation plans that are going to be useful for everyone. And I will just end here with some resources. Sally shared some of these with you already, but definitely all the CDC has a great amount of information on their website, both the compendium as well as the coalition guide for starting a fall prevention program at the local level is located at that first link there. The National Council on Aging also has a great resources. The Community Toolbox, which is out of Kansas University, has a lot of tools on coalition building, on program planning, evaluation, etc. So it is a great resource. And then you can also use us as resources, members of the Colorado Older Adult Falls Prevention Coalition, and many of the presenters of these webinars. We'd like to make ourselves available to you. If you are interested in joining the coalition, please contact Pam Allen, who is our current chair. That is her email there. And if you're interested in particular with stepping on Tai Chi, Atago, or STEADY, Sally Thorson can help you, figure out whether training programs are going to be available and can give you a little bit more details about as we go along building this infrastructure. And then we also have our Colorado Older Adult Fall Prevention Coalition website, which is where all of these webinars are housed. So please check them out, and it's a blog site, so feel free to leave us a message, leave us questions, check out resources, add your own. It's meant to be a collaborative site, so we are really excited to have had the time with all of you over the last 7 webinars to give you some information, and just want to thank you for your interest in fall prevention and for participating in this webinar series. Thank you, and I apologize. Erin, do we have any burning questions that have come in?
We did not have any questions come during, and I am in the process of opening the phone line, so if people have questions, they can feel free to ask.
I know we're over time, but if anyone has any questions.
Okay.
Well, my contact information is showing on the screen there, so please feel free to call me or contact me if you wanted some more information. I know I was going through the end there really fast, so feel free to call me and contact me, and I'd be happy to give you some additional information about what we're doing, or to give you some other tools that might be helpful to help you in your own local communities.
Okay, well, thank you, Lindsay and Sally. That will conclude our webinar.